So there are many different causes of hair thinning and hair loss. Something that I'm seeing a lot in clinic at the moment is something called telogen effluvium, which is where your hair just sheds and comes out in clumps. Now, people always describe this when they come to clinic as being a very frightful experience, and they find that they've got their hair coming out in the shower, in the plug hole, on the pillow, on the floor, and it can be very upsetting for patients. And it's normally a response to your body going through some kind of stress. So you might be unwell, it happens after pregnancy, or it might just be a general stress anxiety response, and it tends to recover well once the period of stress has recovered. Another big cause of hair thinning is something called androgenetic alopecia. So this in men is also known as male pattern baldness, or common balding, and it's very testosterone dependent. So men have got testosterone receptors in this top and front part of their scalp, and that's why, as a response to the testosterone, as they get older, they tend to thin in these areas. Now, women, and it's less often known about, but they also get a form called androgenic alopecia in women, which is also known as female pattern hair loss. And for female pattern hair loss, it's also associated with a condition called polycystic ovary syndrome, which you can get in younger girls, but also you can get it in as women get older. And it tends to, again, be very hormonal and genetically dependent. And then there's a class of autoimmune hair loss called alopecia areata, where your immune system starts to attack the hair follicles, the stem cells in the hair follicles, and the hair comes out in patches like this, and it can be very extensive. And these patches tend to come and go, and we do have lots of good treatment options for that. And then finally, the least common cause of hair loss is the inflammatory causes of hair loss, which is where you get inflammation in the scalp, in the hair follicles, and they can actually damage the hair follicles. So it's why it's very important to get a correct diagnosis and start treatment quickly with these conditions, because once you get scarring of the hair follicles, it can be very difficult for the hair follicles to grow back. So there's a rarer condition called lichen planopilaris, and in women there's a subset of that called frontal fibrosing alopecia, where they get a band of hair loss at the front, but that's relatively rare. So there's not one treatment for hair loss. It really depends on what the cause is, and we have to be absolutely confident with the diagnosis before we start talking about treatment. So in such case, normally talking to a dermatologist, spending some time with them, going through the symptoms and doing a thorough examination is enough to get a diagnosis. Sometimes we need to do blood tests or to do a scalp biopsy. And doing a scalp biopsy is the gold standard in diagnosing hair loss disorders, but we don't do it if it's very obvious what the cause of the hair loss is from our initial assessment. So blood tests that we might do may look for common causes of hair loss, such as vitamin deficiencies and thyroid disorders, and also look for any signs of having autoimmune problems. Then, as a general thing, we tend to replace vitamin levels to quite a high level for patients who've got hair thinning. Now, in a Western society, I think it's well accepted that it's very, very rare actually for people to have a vitamin deficiency that is causing their hair problem. However, we do know that there are certain vitamins that need to be present at a high normal or even slightly over the normal range in order to support that hair regrowth that we're trying to achieve with the other treatments. So it's a very good, we often give the hair vitamins as a supportive treatment, but it's not a treatment in themselves. And then there are a lot of hair tonics that are available. So Regain or minoxidil, which is available over the counter, it works really well. Minoxidil is an old-fashioned blood pressure tablet, and it was found incidentally to promote hair growth. So it's easy access, you don't need it to be prescribed. And then I also compound for my patients higher strengths of minoxidil up to 10%. And I also put other active ingredients in them. So melatonin, which is a sleep hormone that we give cashmere goats to increase their yield, and also finasteride, which has got very powerful anti-testosterone effects. So we can then treat the scalp problem by just applying the tonic on at night time to the areas where it's thinning. Now, if there's an inflammatory cause for the hair loss, such as alopecia areata or lichen planopilaris, then we can use a steroid ointment. It depends really on the cause. And we can use non-steroid immunosuppressants as well. Then there are also a variety of tablet treatments that we may decide to give, which depends on the cause as well. So for women with androgenetic alopecia, we can give a tablet called spirolactone, which helps with the hair thinning that you get as women get older. And for men, the equivalent is finasteride, which can also be given. And then in combination with all of these, we do now do a procedure called PRP, which is where we take the blood, we spin it down and concentrate it for growth factors, and we inject it with lots of little injections in the scalp. And it works really well, but not when it's done by itself. It has to be done with these other treatments that I've spoken about. But from my experience, I find that when you do the PRP together with these other treatments, then you see the results a bit quicker. Whether we can regrow hair depends completely on the cause of the hair loss. So hair loss is subdivided in our minds as to a non-scarring hair loss, so things like the hair shedding or the hormonal or genetic types of hair loss, or even alopecia areata, which is the autoimmune type of hair loss. So these are non-scarring and their hair follicle stem cell hasn't been affected. So with the right diagnosis and treatment, we can get hair regrowth in these patients, as long as it's not too advanced. Now, then you've got the scarring alopecias, where you get inflammation and scarring around where their hair follicle stem cell sits in the bulb. And once you've got damage of that stem cell compartment, it is very difficult to get hair regrowth. So with those kind of conditions and patients, it's important that we make the right diagnosis and offer treatment at an early stage, and also make it clear to patients that the aim of the treatment is to stop the progression of the condition any further. So stopping hair loss, it depends on the cause as to exactly what treatment options we give. I will use an example of women who have female pattern hair loss or androgenic alopecia, and sometimes it can occur in a condition called polycystic ovary syndrome. Now, with these women, it's important to make sure that they're not on any hormonal treatments that can accelerate the hormonal type of hair thinning. So certain types of oral contraceptive pills or HRT can accelerate this. So it's important to give the information to women about how other hormonal treatments for other conditions can affect their hair. And then we can give targeted treatment, such as the anti-hormone tablets spirolactone, which can help thicken the hair. We also use it to treat acne. And then the minoxidil that you find in Regain, it's called Regain, you can find it in Boots. We can use that, and that can even be prescribed orally as well. But the problem with that is you start to get hair growing everywhere, not just your scalp. So that's an important thing to consider. So the hair follicle grows, it goes round in a cycle, and this cycle takes many years. So what it's important to explain to patients is that any treatment for hair is going to take a long time to see results. You shouldn't expect to see results in weeks or even months, but we're talking about looking at the response to treatment at 6 months, a year. And the one incident where I find that you get to see quicker responses to treatment is where you have a combination approach with different treatments, where you take them 2 or 3 different things all together, and you tend to see results a bit quicker when you are approaching the hair loss from different angles.